Hello, everybody. This is the case of Stanley. Let's dive into this. He's 30 years old. He got married 4 years ago after a 5 year engagement. So that's quite a while. He's been with this particular person, his new wife. The couple didn't have any sexual relations before they were married. So that would have put it at least 5 years prior to the marriage. No sexual relations. And here's this key portion right here is that Stanley's wife assumed that her husband avoided premarital sex because he had moral convictions similar to her. And the key word that I'm going to circle here is the wife assumed. And why this is key is we really need to try and understand from Stanley's perspective or Stanley's point of view if that's the case, because if not, then there's something else going on. If it's due to a religious or moral or cultural conviction, that's different. So let's continue on and see how this plays out. So the wife assumes there's no premarital sex because of his convictions similar to hers. The wedding night comes around. She nervously awaits some sign from Stanley. So there's kind of a key phrase. I'm going to also circle that, essentially some sign. And when we're talking about sign, according to the DSM, what we're talking about, and I'm looking at it right here in the DSM TR, some sign is typically where there is a desire, let me come back here, that there's a desire for or even sexual thoughts or fantasies. That's coming from the DSM TR. So when we're talking about awaited some signs, when we talk about behavioral definitions, this is kind of, if we put that in clinical language, we're talking about a desire for or sexual thoughts or fantasies. So here we go. It looks like instead he suggested that they just get to sleep early so that they can make their plane in the morning. And so she assumed he was tired and the couple went to sleep. So there's a lot of assumptions going on. We don't really have any clue from Stanley as of yet. So at this point, there's not much we can go on other than it seems to be somewhat normal behavior. Other than that wedding night was kind of curious, but hey, people get tired. It might be a long day at the wedding. So here we go. After several days, she finally confronted him about his lack of sexual interest in her. So this is where things get a little bit more indicative of what's going on. So here we go. Several days passed, and she confronts him about this lack of sexual interest. So this gets back up to this first part of having a desire or even having sexual thoughts or fantasies about even having sex. So several days, at this point it would be considered abnormal behavior. Just had a wedding night. She's wanting sexual relations with him, and yet it appears like he is still having a lack of sexual interest in her. She seemed surprised, or Stanley seemed surprised, and said, "I'm sorry, I thought you weren't interested in sex either." So this is where we finally get Stanley coming in, and his interpretation was that she wasn't very interested in sex either. This interesting phrase. Now this is what you need to pay attention to. Either. So it's almost like it flew under the radar for so long. This gets back to her assumption that it may have been due to moral convictions, when in fact for him it may have been low desire, and he figured because he didn't approach her, she didn't approach him, that they were both mutually not interested. So it appears that because of that kind of little talk or confrontation, they did end up having sex that night. but it felt forced and was unsatisfactory. So there's a couple of other, so they ended up having sex, felt forced, but unsatisfactory. So Stanley continued to show little interest. So here we have a continuation of the behavior. Again, the definition being little interest. So this gets back up to here, and I'll just go ahead and write that phrase. Little interest. That's another kind of clinical behavioral term as we can begin to define little interest. His wife began to buy sexy clothes, perfume, again, trying to arouse him, arrange romantic dinners, even went to the extent of renting pornographic videotapes. So she is kind of pulling out all the stops in an attempt to increase his desire for or interest in sexual activity. But we learned that her attempts were only marginally successful, and Stanley responded half-heartedly, and eventually the wife became frustrated and stopped trying to get his attention. So here we're left with this scenario here. We don't have any indication at this point. There's a couple of things that we'd want to explore. One of the common mental health disorders that impacts low sexual desire or interest in sex, certainly one of them that needs to be considered is depression. So that's one thing that we need to consider. Another one can be, let me erase that. Let's see. Another one can be stress related or anxiety. I kind of lump those two together a little bit, although they can be pretty different. You can have job stress, and then there's also anxiety. Maybe it's worry about sexual performance, worry about the act of sex in general. So they can be separated. I'll lump them together for the sake of this video here. There are, so let's see, depression, anxiety, and stress. I'm going to look real quick here. Let's see. Substance use, yeah, certainly that could be considered something to consider as substance use. So all of these things, another medical condition, as we've kind of studied throughout this course, we need to consider that as a possible differential. And then other sexual dysfunctions is another one as something we need to consider above and beyond what this particular scenario is really kind of indicative of what's called male hypoactive sexual, so male hypoactive sexual desire disorder. That's a long name. Okay. The thing about this scenario right here is this is probably the most accurate diagnosis based on the information we have, although we do need to explore more from Stanley, and that's why this would be, in my mind, at this point, it's actually more of a provisional as far as the most likely. I didn't even finish the word there. Provisional. There we go. This would most likely be a provisional diagnosis for the fact, if we look at the DSM, the first criteria, that there needs to be persistent or reoccurrent deficit or deficient sexual or erotic thoughts or fantasies or desire for sexual activity. So I believe we have that. A minimum duration of 6 months. This has been going on. This is where things get tricky, is because if we go off the assumption of the wife that this has been going on for quite some time prior to marriage, then we easily meet that criteria of longer than 6 months. If we're merely going off of the wedding night and the several days after, that's where things get a little bit tricky as far as the timeline, because she then tries to spice things up and help things out a little bit as far as arousal goes or interest. It doesn't say for how long though, so it's hard to know that went on for 6 months. So This is why, in this case, a provisional diagnosis is probably the best bet until you interview Stanley and find out a couple of questions. So some of the information I would want to know is prior to the 5 years, prior to marriage, so essentially the 5 years engagement, was the reason for the lack of or no sexual activity, was that due to kind of religious, moral, cultural traditions or beliefs, or is that a lack of interest? Kind of like he points out, he thought that she wasn't interested either, and so he didn't pursue it. That then would qualify because he just wasn't interested, and then that definitely would kick this into that diagnosis. The other one, it causes significant distress. So this is also one where you'd have to explore with Stanley to see if it causes significant distress in the individual. And he seems almost indifferent to it. So this is where things could get tricky. Obviously, the wife has become frustrated and stopped. Stanley's half-hearted about it, but that doesn't necessarily mean distressed. However, you would have to ask him more. It's likely causing distress in the relationship, as we can see, but whether or not that's personally distressing to him, that's what we need to find out. As far as depression, we know that that can definitely cause impact libido for males and females, stress and anxiety. Similarly, we often see with males that this can also cause erectile dysfunction issues with males, as far as depression and hypoactive sexual desire disorder can definitely impact and cause impotence and or erectile dysfunction. We would need to find out about substance use, more about the medical conditions, and that would be kind of the extent of it. The other thing, though, that I'm going to point out, and I'll write this in red, is this idea of exploring other sexual issues. And what I mean by that is this could be a variety of different things. Who knows, when it comes to hypoactive sexual desire disorder, what this could actually entail with regard to his wife or other possible sexual orientations. Who knows? And so I think this is also important to consider and be open-minded and be objective as possible, that this might be typically, or this, not typically, but this could be something else that we need to keep on our radar. Is we have all these other mental health conditions, but we also have this possible question of, are there other kind of sexual issues, sexual orientation, other different things that we just are not aware of with Stanley. So there we go. That's this case scenario. I would say for now, provisional male hypoactive sexual desire disorder. But boy, do we have a lot of kind of things, differentials that we need to rule out prior to really kind of putting a stamp on this and saying that this is it. Certainly in this case, you'll want to refer to a primary care physician for sure to see if there's anything as far as physical going on, medical conditions, otherwise, that the doctor may want to treat or figure out what might be causing this on the physiological end. Also, as by way of treatment, if it were to be diagnosed as male hypoactive sexual desire disorder and it comes down to sexual issues, desire for or sexual thoughts and fantasies and the lack thereof, and issues within the relationship, certainly this would be appropriate to even refer them to a sex therapist or someone that specializes in sexuality. That would probably be the most appropriate unless you've had some training in this. After an exploration, I would still explore first off to rule out some of those differentials. You might stumble on, maybe it is depression or maybe it's stress or anxiety. However, if you were to begin to rule those out and realized, yeah, this is something deeper, this does have to do with some sort of sexual issues, and also within the relationship, definitely refer out to a sex therapist. They're trained in these issues and know how best to design a treatment plan around that. So this is a great case example for something that you definitely may see during your career at some point. This could also likely be something similar, not exactly, but could be something similar along the lines of something you're looking for with regard to its mirror image, which would be female hypoactive sexual desire disorder. So kind of similar different descriptions and criteria that you would need to look at, and then likely refer to a physician and or sex therapist after you've ruled some things out. So they're very good. There's the case of Stanley.